Welcome back to On the Beat, everyone. I'm your host, Rachel Hurt, and today we're in the studio with my friend, Dr. Bethany Hairston of Vitality Dermatology. And today we're going to be talking about something that I think we all have a lot of questions about. And that is, as a dermatologist, what is the diagnosis that you treat the most?
Well, the diagnosis that we treated the most at Vitality last year was actinic keratosis. The nurse practitioners that I work with, Michelle Beasley and Kayla Wilson, and I treated over 7,000 people with actinic keratosis last year.
Now tell me exactly what actinic keratosis is,
Yes.
in layman's terms.
Yes, so an actinic keratosis is a precancer, and it usually looks like a red scaly lesion, and if it's not treated, it can turn into a skin cancer, and most commonly it would turn into a squamous cell carcinoma.
Oh, wow. Those all sound like very large, scary words that I don't ever want to hear you tell me I have. Okay, so who is most at risk for those types of ailments?
Yeah, so interestingly, anyone can have a precancer, but in general, the lighter the skin tone and the more outside exposure, the more sunburns a person has had, puts them at higher risk.
And how do you treat these? Obviously, there's going to be multiple ways, and I bet with everything that you brought to share with us today, you can tell me the most common ways that you treat and then hopefully some preventative measures.
Yes. So the most common treatment I do is liquid nitrogen, and this is a cryostat, so liquid nitrogen cryotherapy. And we basically can burn individual little precancers with this method.
Okay.
We also use a prescription cream, so if someone doesn't want treatment in the office, this is a prescription that I have a patient use twice a day for 2 weeks, and it will gradually treat the actinic keratosis. We also have a device at our office called photodynamic therapy, where we apply a liquid that's light sensitive, and then a patient sits under the lamp for 16 minutes.
Oh, wow.
And it treats like an entire face full of actinic keratosis.
Oh, that sounds cool.
Yes.
Is that a new type of treatment?
So it's new in the last few years. The liquid nitrogen is the one that we've had for decades.
Yeah.
So, but hopefully we can get in prevention mode and not have to use these methods.
True.
And so, again, it's all related to the amount of sun a person has had. So obviously, as a dermatologist, I'm a big fan of sunscreens.
Great.
And I brought my display here.
Well,
to
tell me,
show.
I mean, so I'm 43, and I will admit that in my youth, I probably didn't take care of my skin in the sun as much as I should. So tell me which one of these are your favorites and kind of why?
Yeah. Well, interestingly, since I have over 10 sunscreens here, the answer I'm going to give you is I really don't have a favorite.
Oh, okay.
It kind of depends on what you're doing, what type skin you have. In general, I tell a person if you're going to be outside on a regular day, maybe running errands, I would have an SPF of 30. If you're going to go to the beach, sit by the pool, or go to the river, I would say a minimum of an SPF of 50.
So there is a difference.
Yes.
In the numbers. The numbers do matter.
There is. And so if I've got someone who's going to be at a real high UV, again, at the river,
That's right.
I would say make sure your number is an SPF of 50 or higher.
Okay. My husband and I often disagree about the number. Does it
Right.
really matter? Because now being older, I have 50 or plus, and with my child, I try to use a higher SPF because she can be in the sun for hours and not realize how much exposure she's gotten until it's too late. So.
Well, and I will say for pediatric skin, sometimes the higher the number can be sensitive, and so I do like the more mineral-based products for children rather than the chemical-based products, and you'll see that on the label.
Okay, good to know. Well, that's all we have time for today.
Great.
But I'm sure there's going to be lots of more questions based on everything that we've discussed today. And if you'd like to talk to Dr. Hairston or any of the nurse practitioners or other members of her staff, the information to contact her is up on the screen. I know they'd love to talk to you. We'll be back after this short break.